Hello, my name is Stephanie, and this is my corrective exercise modality presentation on the vibration platform. Starting with a description and some of the history and development of this modality. So the vibration platform is a modality which involves the user standing on a vibrating platform, and that promotes whole body vibration, which stimulates muscle contraction, and is said to promote gains in muscular strength, power, balance, and bone density, to name a few of the proposed benefits. So again, there's many applications, so I have some of them listed here, including recovery, so minimizing muscle soreness, weight or fat loss, circulation improvements, muscle stimulation, flexibility, lymphatic drainage, increased bone density, and hormonal regulation specifically. It's been said to help in reducing cortisol. So some of the history. So Gustav Zander, he established vibration therapy in 1857 and he invented numerous early exercise machines. But the whole body vibration modality is credited specifically to Dr. John Harvey Kellogg, and he actually invented the first full body vibration machine in 1895. Um, so he planned or he hypothesized to use this for improvements in circulation or helping with constipation, actually. Um, and his equipment was used to help rehabilitate injured athletes in Russia and was believed to have played a prominent role in their success in the 1930 Olympics, in which they won 43 gold medals. I thought that was interesting to include, and that comes from the source listed there, Singh and Varma, in their 2023 work. On the right side, I have two examples of vibration platforms. So the one on the top, that's one that has, of course, something to hold on to. And then there's also more portable, smaller ones that don't have that extended portion for the user to grip onto. So some of the common techniques and errors. So it's relatively easy to perform. Like we saw on the last slide, you are standing on a platform. Depending on which type you're using, you either have something to grip onto, or on the more smaller portable one, you just stand on it. So some of the common techniques or applications you can do on the vibration platform are listed here on the left. So isometric holds, an example of that would be like a squat hold on the vibration platform, and that's said to improve muscular strength and promote recovery. We can do balance or proprioception, work on the vibration platform, so like a single leg stance to enhance our motor control and joint stability. We can do stretching on the vibration platform, such as a hamstring stretch to improve our range of motion and recovery, and also dynamic movements, such as completing the full range of motion, such as a squat on the platform to improve muscular strength and proprioception balance throughout the movement. So there are errors. Common errors include overuse. So, prolonged exposure prior to becoming acclimated to this modality can overstress the muscle and make the user more susceptible to injury. Improper stance can reduce the benefits and increase risk of injury. And then compensatory patterns. So, um, lack of conditioning or instability can result in the user developing some sort of compensatory patterns to improve their balance on the platform, but then, could be run the risk of injuring themselves in that case. So I have some techniques examples on the next few slides. So this first one demonstrates a dynamic movement on the vibration platform.
And flexibility. The large surface area enables you to perform a variety of different workouts and is ideal for squats, lunges, calf raises, planks, push-ups, and many more exercises.
Okay, so that was the first one.
and flexibility.
Sorry. Now, this one is stretching on the vibration platform. I will say in this video, it looks like they don't have the vibration platform on. Um, but yeah, it would be on in the example that we're referring to.
Push the rear heel down into the vibration plate. The rear leg should be straight, and you should feel the stretch in your rear calf. Hold for 30 seconds. Push the rear.
Okay, and then our last one is an isometric hold on the vibration plate. So some common characteristics of the prescription for using the vibration platform modality. It can be incorporated in different parts of the corrective exercise continuum, but it seems to be most commonly associated with the activation phase, which was noted in a study I have listed here, um, which found improvements in muscle activation and neural stimulation with the use of a whole body vibration platform in that static squat position. So then below we have an example of activation phase programming. So continuing with the example of the squat. So for a dynamic squat with hold, I have the primary muscles targeted there. So the glute max and the quadriceps. Then the exercise sets and reps. So 3 sets, 30-second isometric squat hold, perceived effort, be moderate. Then the exercise tempo is listed there, which was 2:32. So progressing with the vibration platform modality can be accomplished by manipulating training variables such as the platform setting. So you can increase the frequency, um, which is like how quickly it's vibrating, um, to increase the intensity. And studies show that higher frequencies promote greater muscle spindle activation with the reference Rittweiger listed there. We could also progress duration or adding resistance, such as weights, resistance bands, and more like functional movements to foster progression as well. Now, some evidence supporting its use. So, this first study looked at whole body vibration training prior to resistance training, and the study population was older adults, so individuals who were 65 years or older. It was 40 people total, split into two groups. So, like I said, they looked at using whole body vibration training prior to exercise or resistance training in the experimental group, and then the control group um, just did stretching prior to resistance training. So it occurred over 4 weeks, and they um, worked out 3 times per week. The experimental and control group, like I said, did either 20 minutes vibration training or stretching, followed by a 10-minute rest period and 20 minutes of that resistance training intervention. For data collection, an isokinetic dynamometer was used to measure gains in muscular strength, and additional measures included body composition, the short physical performance battery, grip strength of the hand dynamometer, and the SF-36, which was a comprehensive questionnaire about health status. So improvements were actually seen in both groups, but the experimental group had a statistically significant improvement in muscular strength measured in peak torque, as well as their short physical performance battery. And then I have a separate source listed down below. In a meta-analysis, it was determined that whole body vibration may be an effective corrective strategy for postmenopausal women, as it can help counteract bone loss and muscle deterioration by promoting bone stimulation and beneficial hormonal responses, such as increase in growth hormone and testosterone, which I thought was pretty interesting. Okay, and then our next source here This study looked at whole body vibration as a corrective exercise intervention in improving chronic low back pain associated with individuals who work sedentary jobs. So the study concluded with significant findings for improvements in chronic low back pain, along with increased engagement in physical activity and reduced disability. So the study involved 41 individuals who worked sedentary office jobs and they had existing low back pain. So the experimental group participated in the vibration training intervention, whereas the control group did not. And the intervention occurred over 3 months, and they average participation was 2.5 times per week. For data collection, participants completed the Roland Morris questionnaire, which is a questionnaire centered around physical disability related to chronic low back pain. And additional measures included the SF-36, like we saw in the previous study, isokinetic test for trunk stability, the number of sick days taken following the intervention period, the Freiberger questionnaire for physical activity level, and the Oswestry Disability Index. So improvements were seen across all measures in the experimental group who completed the whole body vibration training. So now I have some certification resources. So there wasn't really a comprehensive whole body vibration training modality certification from like an accredited organization such as NASM, but there's many independent organizations out there that offer certifications, and I listed here the all the ones that I could find. The first one is by Hypervibe. It's the whole body vibration instructor certification. I have the links there if anybody's interested, that you can follow. It is a 16-hour self-paced online course that costs $500, covers fundamentals of whole body vibration training with fitness and recovery applications. The next one is the whole body vibration training, occupational and physical therapy integration. So this is an online self-study course. Appeared to be geared a little bit more towards continuing education, like I have listed there. It's worth continuing education credits for healthcare professionals. This one was approved by the American Occupational Therapy Organization, and it covers whole body vibration training as a treatment to improve activities of daily living, functional status, mobility, and neurophysiological adaptations. The FMT vibration specialist is an online or live 4-hour course that costs $250. Again, this one is also valid for continuing education credits, so a little bit more geared towards healthcare professionals. And it covers applications of whole body training as an as an intervention for neuromusculoskeletal rehabilitation. And then the last one on there is the targeted vibration therapy certification. Again, an online self-study course. This one is a little bit more expensive at $1,250. And then it also had a prerequisite course that you had to complete called Unlocking Mobility, which was $99. And this covers the applications of vibration therapy to improve mobility, recovery, and optimize movement quality. And then these are my references. Thank you.